Welcome to What is Black, the podcast where we talk about issues important to raising healthy and thriving Black children and teens. I'm your host, Dr. Jacqueline Duget. Today, we have the second episode, part 2 of our conversation about addressing gun violence. And I thought it was important to continue the conversation based on feedback from our first episode. And I think this continued conversation is just as impactful as our prior conversation. And I hope that you get something from this conversation and that it helps, hopefully, to advance the overall idea that we definitely need to do something about the growing rise in gun violence in our country, and unfortunately the disproportionate impact on Black children, other children of color, and just our community in general. So let's get started with this conversation, and I would love to hear your thoughts about these 2 episodes. And there's a possibility that we might have a third episode, again, to just continue the dialogue regarding this very important topic. So let's get started with today's conversation. So I'm so excited to have another guest with us today to continue our conversation about addressing gun violence prevention. Our esteemed guest today is Dr. Chinonyelum Obih, who is a general pediatrician with Swedish Medical Group, a subsidiary of Providence St. Joseph Health System. She completed her pediatric residency in general pediatrics at the University South of Alabama with transitional research year at Seattle Children's Hospital in inflammatory bowel disease. She's currently a member of the Swedish Medical Group's Diversity, Equity, and Inclusion Committee and PSJH's Digital Innovation Group, as well as a fellow of the American Academy of Pediatrics with membership in the sections of Minority Health, Equity, and Inclusion, section on Immigrant Health, and Advances in Therapeutics and Technology. And we're so happy to have Dr. Obih with us today.
Happy to be here. Thank you.
Awesome. So our last spoke with our other colleagues, Dr. Khan and Dr. Abiba Stelahu, about this issue of preventing gun violence. And in our conversation, we each shared our reflections on some of the recent events. And since that time we spoke, there have been definitely more. So I just wanted to hear your thoughts about just the reflections in general about these. I feel like there are more reports of ongoing violence, most notably Buffalo, New York, and Uvalde, Texas. And as we've heard, there have been more incidents recently in the news.
Yes. Really, unfortunately, this is quite a dynamic time that we're seeing with regards to gun violence and mass shooting events. And all of us as Americans, we're all affected, but disproportionately, as you have been discussing, people of color, especially Black communities and minority communities, have been affected by this on a greater scale. My first responses to Buffalo and Uvalde as well, I found that they were heartbreaking and sickening. But it's interesting because I feel as I've grown as a millennial in this generation. Growing up, we had the Columbine shooting, which was something that I grew up with as a younger kid. And then getting older, we had, random acts of violence that were completely unsensible. But then now, as a practicing pediatrician, and now this context about Black Lives Matter and those of us who are experiencing racism and now having talks around racism and equity, it's even more heartbreaking and sickening that such things are still happening. And it really kind of instilled a certain amount of disquiet and frustration in me, that not only is this something that we're still seeing in this day and age, being that this is 2022 and the conversations around violence and the conversations around mental health and the conversation about access to weapons is still ongoing and kind of kicked down the road. But one thing that I realized about all of this is that violence and risk for violence is being woven into our social fabric as an American. Violence on a mass scale is unfortunately quite a long-standing part of our culture, and so I feel that, what we're seeing in response to this is general conversations in, to enhance health, but then at the same fact, we're getting pushback against, gun reform with those that have interest in promoting the comfort and stock in harmful traditions that are American, which is ownership or uninhibited gun ownership. Even in the past, protesting racism, I felt that we were protesting, and folks were against it because it felt like we were protesting what it meant to be American. And quite unfortunately, this is where things are going. Again, like I was saying, risk has been woven into our American fabric. And so, being raised here in the United States as a Nigerian person, I felt that the most important thing that we had to think of when we were kids was looking both ways before we crossed the street, or not talking to strangers. But now, with even recent events, it's how can we talk about things that are uncertain for our children? When they see something, who should they say it to? Are you feeling bullied enough to want to hurt other people? Don't go buy a gun. These are strange conversations that we're having to have with children, and having to explain the world around them. And it's really quite unfortunate.
Oh, I mean, I think your perspective is, I think, is really really informative to the discussion we're going to have today, because again, we talk about this complexity of gun violence, and I think the conversation with our prior guests, I think, really underscored the complexity of the discussion. I think some of the means of sort of addressing gun violence that some of our legislators have proposed seem to be sort of, they're around, right? They're circumventing the actual real reason we're having these issues, right? And it's not to say that, for me, my personal experience, right? My personal thoughts are that I think mental health is an important part of the conversation, but it doesn't stop there. This dichotomy of a good person with a gun will match a bad person, quote unquote, a bad person with a gun, as a way to sort of deal with this, or even to sort of really create a citadel in the school system, right? Let's barricade the kids in. So I almost feel like, again, and I've mentioned this before, it's almost like a victimization of the people that want their freedom, right? They want to be able to, to be kids, right? I mean, that freedom to just be a kid and to go to safe places, go to a grocery store, participate in, in the streets, festivals in the streets, right? And not feel unsafe. And so I feel like some of the measures are really about, they say it's protecting people, but I feel like it's not protecting the people that really need to be protected. And so again, this complexity of the discussion, and, having our further discussion today, really talking about a little bit deeper about this idea of how gun violence, and this idea of gun violence prevention, how can we look at it for communities of color, children of color. So I just wanted to have a little bit more of that conversation, especially, since we talked at our last episode, that the data really show that communities of color are disproportionately impacted and affected. And knowing that there's this disproportionality, we talk about racism, so structural racism, how that might play a role. But I just wanted to get your thoughts about, how do we discuss these impacts, the effects of gun violence in our communities and on BIPOC children?
Right. So when it comes to, and to even piggyback on what you were saying, so that our children can actually feel safe going to school, being in safe places, as we even briefly mentioned before we started recording, even going to a hospital should be able to be something that someone should feel safe about. But when it comes to looking at the data, looking at one study that was published by the Boston University back in March, I think it was on March 14th, what they did show was that even in the 5 years before the pandemic began, Black children compared to white children were already at a significant higher rate of being risked for exposure to firearm violence. And so the New England Journal of Medicine actually even published that from 2019 to 2020, that there has been such an increased relative risk in in firearm related deaths in all groups, particularly children of color and children. For suicide, for with suicide, homicide, even unintentional and undetermined deaths among children and adolescents. And this was about a 29.5%. And then since the pandemic, that there has been even two times of that as high as an increase in this particular group in comparison to others. So when we're talking about children and children of color, they are at risk. Um, and so what this means and how I look at this data is that we have a position of crisis. We have a population in crisis. And so whenever there is an area where we're missing something, this is where we need to focus attention. And so what can be done with regards to neighborhoods of color? What can be done to prevent those children either having exposure to unintentional death? And sometimes we have seen this even play out over the media with regards to shootouts, for example, between police and perpetrator, and then unfortunately a child gets shot in the process of that. How can we improve uh, uh, risk prevention measures so that these children are not impacted in anything like that? And then even that comment is layered because there are so many layers there with regards to how certain perpetrators are even approached by police too. But what can be done to address young children of color? And so, therefore, what I have noticed that I've seen here, especially in the state of Washington, is that we've done a lot of advocacy with regards to firearm prevention and firearm teaching, at least with those who may have access to guns at home or access to gun related or neighbors with possible firearm access. So Washington State, the chapter of the American Academy of Pediatrics here, we have partnered with the Alliance on Gun Responsibility. And what this does is it focuses on ending gun violence crises in our communities by partnering with other civil rights leaders, experts, and citizens, um, hoping to advocate, at least at the end of the day, for gun responsibility. So what this actually ends up looking like is, for example, in 2018, we raised the age to purchase semi-automatic assault rifles and other weapons through one particular measure that was I-1639. In 2016, we created an extreme risk protection order to try to prevent the amount of those who can get access to weapons without a credible background check. So we were closing some of those background check loopholes. Um, Public education, we have actually even partnered with our school board so that we can teach people about, uh, you know, fears about gun violence, gun access to weapons, how to safely and anonymously report. For example, in school, if someone has a weapon or they know someone in their family has a weapon, who they can come forth to discuss about that with their school counselor. School counselor then puts in a ping to law enforcement. Law enforcement pings back to the person, lets them, or to the gun owner, lets them know that, hey, we do know that you have a gun. Is it registered? And all of that. So while this isn't a way to completely end, uh, you know, uh, negligent gun ownership, at least it kind of helps with regards to reform. And then from the medical standpoint, we do have all patient safe training for all medical providers so that we can talk to our patients about suicide prevention, homicide prevention, and ways to seek help should they have access to weapons. Then for Washington State, we also do have a firearm tragedy prevention network. And so this was developed in 2016 to provide a forum for organizations, individuals, and different businesses to provide a wide range of perspectives and backgrounds to work together to prevent firearm tragedies. So again, really advocating gun safety, really advocating for gun legislation and reform, and then at the end of the day, patient safety as well.
Oh, that's amazing. Because our last conversation, the last episode, we did talk about like the role of pediatricians in addressing gun violence prevention. And I mean, I love the fact that your state's chapter of the American Academy of Pediatrics has worked with other organizations. Like you said, the Alliance on Gun Violence Prevention.
Yeah, gun for the Alliance for Gun Responsibility.
Oh, gun responsibility. Okay, so I think that's important. And I think what that really says, right, is that in order for us to do this work, right,
Mhm.
it's not going to be one agency alone, one person alone that's doing this. It really does have to be like all hands on deck
Absolutely.
to do the work. Now, I don't know if by chance if there's been any evaluation of some of the laws that have been enacted in Washington State in terms of the different positive or no change as a result of enacting some of the laws that Washington State has enacted.
Right. And right now, I can only say that we're kind of looking at the data still. I think we had a chapter meeting a couple of weeks ago where some of this information was brought up, and we're still looking generally at the trends here. So I would be interested to see, exactly, had this actually helped. But quite unfortunately, this year there have been a few gun scares in the Washington state. Thankfully, no actual gun related events, but there still have been a few episodes. I think we've had about two or three active shooter or somehow some sort of school threat that have been relayed to the media. So I'm hoping that this may mean that maybe quite unfortunately we're talking about numbers coming down and three is a good number, but there's still much that can be done. So I'd be happy to take a look at data and see how far along we've come with some of these interventions.
I know many of the interventions that Washington State has implemented are similar recommendations from the American Academy of Pediatrics. The organization that we're part of that represents pediatricians, professional organization for pediatricians. So again, I know there is evidence for these laws, right, and in terms of gun reform. But what's interesting, right, is that not each state, it's really left up right now to each state to come up with ways to address this. And because each state has, yeah, there's not consistency across each state. So what one state does hopefully becomes a model for another state and says, oh, you know what? Kids are important. People are important. Let's make some changes, right? I think that's the ultimate hope. That's my hope, right? Is that it comes down to like, oh, we want to save people's lives and we want to make sure kids feel safe and can be kids, right? That should be like the common conversation, I think. But I think we kind of are missing the boat sometimes as a country overall and having those discussions. So I wanted to go into that a little bit more, this idea of how we can help our families um, sort of deal with these tragedies, and maybe some solutions that maybe we can help them, like to advocate on behalf of their families and their community.
Right. So right after the school shooting in Uvalde, I did talk with some of my parents and family members and things like that about how their kids are feeling. And I did try to incorporate that with each of my well visits. For example, when a school age child came in, it was more so like, okay, how are you feeling? What is going on at home? Have your kids seen the news? What kind of questions have they asked about it? And so most of the time it was more so of an encouraging of, hey, talk to your child, see how they're feeling at school. Do they feel safe at school? Do they feel safe at home? Then it comes down to age too when it comes to discussing about tragedies that do happen in the world to their kids. So, for example, if you have a younger child, early school age, talking to them about, hey, something dangerous happened at a school. I do want to let you know that you are safe here, and I'm doing everything to keep you safe as a parent, speaking as a parent here. Um, or hypothetically speaking, as a parent here, that we're doing the best that we can to keep you safe here, but something did happen that was bad, and some people got very hurt. And so, letting them have an understanding that, this wasn't okay, but of course, not going into deep discussion about it with someone in an age that may not even be able to comprehend either death or safety to begin with. Just being able to parse that out a little bit is important. Then for a child that's a little bit older, say older grade school age child, um, saying where it happened, talking about the events that happened, but not even in the greatest detail is all that important, but at least just letting them know that this happened, and someone did a very bad thing. And so these children, unfortunately, were killed as a result. But then, as a parent, talking about that uh, they are safe at home, they are safe at their school. Parents are going to do what they need to do to prevent this from happening, which means talking with their school teachers, talking with their school board about what kinds of preventative measures their schools are taking with regards to this, and then reinforcing if their child does not feel okay to come talk to the doctor, and then so on and so forth, depending on what their child is able to muster and mentally handle and understand. Another thing that I have encouraged parents to do is to ask their teens to come to the doctor and talk with them, or see a school counselor if they are gravely affected. Some of the ways that children parse through stress and trying to understand what has gone on is going to manifest differently, even by age. So younger children may not eat well, they may not sleep well, they might have um, uh, uh, even changes all the way down to bowel movement interruptions. We might even see some incontinence, reversion of some of the skill sets they previously had. So that should be an indication sometimes, even if there isn't spoken trauma that's going on, that parents can kind of look at and see this might be a flag for a child to be brought in. For an older child, they may again not sleep, not eat very well, but then they might also express some despair with regards to feeling helpless or hopeless. This will be another reason why a child would need to come in, at least so that we can see what ways we can and we can help them, what resources can be provided. So again, basically just going through all the different ways that we can manage or we can address grief, trauma, and difficulty understanding traumatic events with children. Particularly in children of color, it's most important for us to be able to assess for these things. So again, those social determinants of health, toxic stressors that they might be exposed to, and then what best ways, resources in that community that we can instill safety and understanding for them, especially after a traumatic event.
So I think the information that you shared for parents, I think is going to be so important for them. Because again, I'm thinking about this generation of kids, right? Yeah, I mean, there have been now several generations, almost like a couple of generations of kids who have had to, since Columbine to now, right, to present, have had to, learn to adapt and live with this issue of gun violence in schools, but just this whole idea of how our society is dealing with gun violence in general. And unfortunately, kids are definitely impacted. If people don't believe it, they are impacted. Their families are impacted, and I think the things that we can do collectively as pediatricians, our role as pediatricians, our role as leaders in the community, and working with other organizations to ensure that we can create a more safer place for kids to live in so that they can thrive, I think is amazing.
I agree. Something else that kind of just came to mind, especially when it comes to children of color, and I was also thinking about how do children with complex healthcare needs respond to situations like this, and even just thinking about how we've had to deal with some of our issues with COVID, for example, not having access to certain things because everything was put at home. I was thinking about some of those about the victims of the Buffalo shooting, and how that store that was not only a central social area for those families was also a prime source of food and nutrition for those families as well. And after that Buffalo shooting, we saw that that area has now have dealing with becoming a food desert, or having lack of access to nutrition. And so something to consider, especially in these in our BIPOC communities. These patients are also going to be more vulnerable to depression, anxiety, less resources available to them, especially after a shooting, particularly in a shooting in a community that that these patients are currently part of. Lack of being able to have a provider go out there for children with complex needs, for example, for physical or occupational therapy, as we do have some of those companies that do provide access to those homes. Now that's interrupted, or that's disrupted, as well as when I think about these children out in Texas that experienced the shooting. So what could have been summer school or extra childcare is now disrupted as well. So for these communities of color that don't have many other resources to go to, the ramifications can be quite large. So it steps up to our pediatricians, not only our parents, but our pediatricians, and then our local communities, governments, and even state legislatures, to be able to provide access to essential services, especially for families during times of trauma and stress.
So again, underscoring this idea, one of the complexity of addressing gun violence prevention, but also really also making sure that we also have an equity lens on whatever interventions are determined, because that makes a difference. Because I mean, you can make one, change one law,
Mm-hmm.
but then there could be ripple effects that negatively impact communities of color, under-resourced communities, um, impoverished communities. I mean, so it all has an impact, right? So when
Right.
when people try to come up with, one size fits all in terms of reform, we got to think about, there might be consequences if you don't really have everyone at the table that should be at the
Right.
table to really think about how do we really make a difference and help communities.
Absolutely.
So, Dr. Obih, this was a wonderful conversation. Thank you so much for joining me today. And as we talked earlier before the taping, this really is an ongoing conversation. Um, yeah, and it will continue to be an ongoing conversation.
Quite unfortunately, but I am very, very happy to have contributed to what you're doing and bringing attention to this. And with conversation comes a solution. So hopefully, through all of this, and those listening in, we can come to multimodal conclusions and solutions to help this ongoing crisis.
Thank you for listening to today's episode. It was our part 2 in our series talking about preventing and addressing gun violence. The editing and music for this episode was by Manny Simone. We want to grow our community, so please tell a friend about the podcast, rate and review, and subscribe wherever you listen to podcasts. You can follow us on social media at What Is Black. That's WHATISBLK. We're on Instagram, Twitter, and Facebook. Please also check out our website at whatisblack.co to learn about our work and to sign up for our newsletter to stay up to date about our exciting projects, our upcoming documentary, Reading in Black, which celebrates Black children's literature. And until next time, wishing you peace, wellness, and joy, and a reminder that you're seen and matter.